She will block it. One leg here. See the coffin joint, pastern joint, something very bad.
اوه باليرينا ها؟
جاي ورا شاطر يلا. They feel it if you have an aggressive voice or not. Maybe a fracture, maybe a fissure. I think she's good. Can you pay me? تاني معاك الموضوع ده كده.
Hello everyone. So today we are having a great visit from our favorite doctor, the very famous doctor Hatem Settin.
Thank you.
And we'd like to make a vet check for this man.
Who's buying here?
I
would like to buy.
So sport horses are always a big problem. You should do the pre-purchase not only to save your money or to take a decision if you are going to buy her or not, but to predict the future of the horse. When you have a full X-ray, ultrasound, when you check her, when you have a report, even if you buy her, you will do a plan for the future.
Yes, definitely.
A good plan. What's her name?
Vicky, and she's 7 years old.
So 7 years old mainly is super young.
Teenager,
Yeah,
right?
no, the premium age from 7 to 10, it's premium for sport horses. We are going to check her now. First of all, the doctor should say hi to the horse. I need her to help me. Best way to say hi is to give a good, like
Pat.
this. I like to do some palpation on the whole horse. For the back, for the legs, for everything, I palpate it with my hands. The experienced doctor, what to do, what's the problem, and what's normal and what's abnormal.
Okay.
From just running your hands, from the experience, you can know if you have a lump or if you have a sensitivity.
Under your fingers, right?
Yes.
It's the touch.
We will start with this.
Okay.
And then we will check the eyes as well. We will
Okay.
check the heart. The heart, we check everything.
Okay, great.
But first of all, we are speaking about the sport capability of the horse, so we are going to check. When I check the back, I check two things.
Okay.
First of all, if the muscle here is sore, you know the area of the
Of
saddle
the saddle, yes.
is much important. And for the jumping horses, they use much of their muscles in the back
In the back.
to do the jump. So it should be perfect all the time. So now I do some palpation. And then I check if the back moves perfectly or it is stiff.
Okay.
Stiffness is not good for horses that jump.
Okay.
The back should move perfect like this.
Yes. And I think the muscle should be soft, right? Not.
Yes, sure, as well. But you see, it's moving
Ooh,
perfect.
ballerina, huh?
Yeah. Here you can find small soreness, but
Okay.
I think it's normal. It's not something you should worry about.
She has been jumping yesterday. Maybe.
Maybe, yes.
She did a big course yesterday.
Then we will check the legs.
Okay.
We will ask her very nice. We will not do a fight with her. We'll ask
Okay.
her very nice. She will go up and then we'll check the leg. بس حبيبتي بس. يلا حبيبتي خلاص. So now I don't find any abnormality.
Okay.
So this is good.
That's very good news.
We will check as well the quality of the hooves.
They are not the best, unfortunately.
No. For me, I don't think it's that sophisticated. I see the baseline, you know. So this is good for me, not
Great.
bad. The angle of the hoof, which should be from 45 to 50 degrees. The hoof, do a line from here at the middle.
Yeah.
This part should be the same as this part.
Like this part.
But this hoof is different from this one. So you should not compare the two hoofs. You should compare
Same one.
the same
the
one.
half or to the other
and
half.
Yes.
Okay.
Okay. Most of the horses you can find some hoof is much lower
Yeah.
or higher. This is normal. You have to try to do some equilibrium or some balance. This is a farrier job
Okay.
with the doctor and with the owner. I like to check the neck as well.
Okay.
La. So now she thinks I'm giving her some food.
Her life
Up.
is the food.
Now she should move her neck without moving her body. You see now?
Okay.
She's-
Wait.
And we will do the same. You see? Perfect neck.
Good girl. Yes, you are.
Now we should walk the horse. I should see hind legs are moving in the same line of the front legs.
Fantastic.
This stride and this stride should be the same.
Excellent.
Okay? So we will check now.
Straight line.
Yes, straight line. So the hind legs are following the front legs. No problem. Come back. Always look at this direction. So horses cannot talk, right?
Body language.
How can you make the horse talk for the vet? By doing flexion tests.
Ah, okay.
So the flexion test is basically I bend the leg of the horse.
Okay.
I bend it for like 30 seconds to 1 minute. And then I leave it and you trot the horse. By doing that, if you have, show me your hand. If you have pain here, then I do like this for you for 30 seconds or one minute. Then I leave it till make pain, right? Because you don't have pain now, when I lift it, no problem, right? When I leave the leg, the horse should only feel pain for 2 or 3 strides.
Yes. And then continue sound.
After this, it should be back to normal.
Yeah, okay.
How much moves does the horse have? 5 moves. Walk, trot, canter, gallop, back. So when you move the horse going back, it's the same as trot, but in walk. You'll see now. You see?
Wow.
The diagonal are with each other. No, Becky. يلا رجعي ورا رجعي ورا شاطرة يلا ها
Come to the back, come to the back, Haya. You can see.
The second, this is the back movement, and then walk.
Yes.
You can hear 4 beats.
Yes.
4 beats.
Okay.
And then trotting, the one we will use it now to check the horse. The left front will move with the right front or right hind, and the right front will with the left hind at the same time.
Yes.
This trot is the best to check lameness. You only hear 2 beats. If you hear a little bit delay, this is not wrong. If it was so fast, this is not normal. From the sound, he should know if the horse is okay or not. You can find the lameness for some horses by head nodding. When a horse have lameness in the front legs and he's going for the trot, when the affected leg hits the ground, it feels bad, huh? So he tries to shift his head out, away. And then the normal one, the sound one, when it hits it, it goes down again, no problem.
Okay.
So you can check the lameness,
Looking at the
head and the neck. If the horse, when he hits the ground with the pained one, he will go up with his head, and the vice versa. Normally, experienced riders, they can see the lameness, because the lameness you have 5 degrees. First one, which is 0, the horse is sound, no problem. 1 means very slight lameness. Only very, very experienced riders can detect it, and the very, very experienced vets. And maybe you cannot detect it unless it's ridden, under saddle. 2, it's a slight lameness, but experienced rider can see it, and experienced vets can see it. 3 is the normal lameness. You see, the horse is nodding, but he can't trot.
Okay.
4, the horse is limping while he's walking. He's walking like this.
Okay.
5,
It's not
off the
able
ground.
To, okay. Not
the
able
ground.
to step on
Yes.
the.
So when you call me, you tell me I have a lame horse, I will tell you what degree.
Now we know.
You should tell me. Tell me it's 2.
Okay.
So I know it's not something very strong, and we can do. But if you tell me it's 5, this is maybe a hoof abscess, maybe a fracture, maybe a fissure, something very bad. Maybe a tendonitis in acute phase. So you should speak this language. Now we will do the flexion test. Normally, when we trot the horse for the first time, we collect data. When I see a horse trotting now, this mare was trotting. Yani I can tell what is the weakest leg from the 4. Then I delay it at the flexion for the last one. Because if I start with it, maybe it will affect all the tests.
Correct.
The horse will still feel pain for the whole test. So I choose the most sound one to start with. Okay? The doctor should be here. This hand should be from inside, hugging the horse.
Okay.
Shoulder to shoulder.
Okay.
You see? And the horse will go up without fighting, without anything. And most of the experienced horses, they know it.
Okay.
Then with my hand here, I do the bending of this, the coffin joint, pastern joint, fetlock joint, carpal joint, and then elbow joint, and the shoulder as well is affected. So I should do not much pressure, just not to break the leg, but you have to do some pressure.
Pressure, yes. And then Haya will need to run with the horse, right?
Yes.
Okay.
You see, completely normal. Sound never changed even for the first 3 strides. This is perfect.
Okay.
This is perfect.
Perfect, very good.
The hind leg, the flexion test should be like this. So all of this at the same line.
So it's very difficult to carry all this weight, or they are helping you, the horses?
Some horses, they don't help like this one.
Okay, so she is helpful. That's good.
My dear.
Pick it up.
Yes, she does. She feels comfortable. خلاص?
Haya.
So it's like this.
Okay.
And then
You let go and trot. Huh?
يلا. ها. So the same. And you should always be careful from the horses which are kicking.
Okay.
They feel if you have an aggressive voice or not. If you have a kind voice, they will accept it. Not the words itself, but
The tone.
yes, the tone.
Hi, are you
يلا.
ready?
You see, never changed, huh? It's perfect. Ha ha. Ha. Saya, see? You have to speak first, huh? Then move, huh? Now she's in the rhythm, no problem. Also, you can check if you have a problem with the nervous system,
Okay.
especially from the back. This is a very important test. Normally, the horse is much stronger than us, right?
Yeah, sure.
That's how it. So if I try to, huh? She will block it.
Yeah.
And now I can never move her 1 inch.
Okay.
This is normal hind limb.
Okay.
If she has weakness, you will still be able to grab her all the way.
Really?
Yes.
Wow.
So I'm using again on this side. I can move one leg here, and then she
Block, yes. Oh,
even she
you back.
she brings me back. This is perfect. And you can do another test for the. You put one leg in front of the no, in front of it, and she should move it back from in 2 seconds, but I think she will not allow me because she's very alert.
Okay.
Okay, we check all of this. We see the mucous membrane as well here. If it has any abnormality or anything, we check as well. We check as well the teeth, anything you have here, the tongue from both sides, so it's good as well. Of course, I will not tell you all things what we should do, because it's a long list, and depends on the owner, and depends on the quality and the importance and the value of the horse. We can go deeper
Into X-rays, you
to-
mean ultrasound?
No, in even MRI.
Oh, wow.
Some preparators around the world, they do MRI for the legs. But normally we do a full set of X-rays.
How many X-rays?
We do
The normal, the one which usually.
we do for the coffins,
Okay.
fetlocks,
Okay.
and normally we don't do carpal, the carpus. We don't do it in jumping horse. And we do the hocks
Yes.
and the hind fetlocks, not the coffins here, but only the hind fetlocks,
Okay.
and the stifles and the back. Now the moment of truth.
Okay.
I will decide now whether you will buy it or you take it from the owner or not. You ready? Ready?
Yes.
Fail. Yes. No, it's a huge success. Congratulations. You should take it, huh? You should use the moment and grab her, huh? For your own.
Yay!
So congratulations. She's a very nice mare, mashallah, very sound. I don't see any problem. The X-rays are clean, are fine.
Great.
I think she's perfect. So can you pay me? No pay؟ خلاص شكرا. ثانية ما أختم الموضوع ده كده.